Bismillahirrahmanirrahim. Today we will have case quiz number 28. Case data: 35 years old white woman with 2 weeks history of acute painful erythematous nodules scattered across her anterior shins associated with ankle pain. Examination: low-grade fever with normal blood pressure, pulse rate within normal and somewhat mild tachypnea. She had also several well-demarcated erythematous tender nodules on bilateral anterior lower limbs, with swelling of bilateral ankles with tenderness to palpation and restricted active range of motion. Examination chest radiograph show bilateral hilar lymphadenopathy. So, to summarize the case has 2 weeks history of acute painful erythematous nodules scattered along the anterior shins. General examination is within normal and with the exception of mild tachypnea and the erythematous nodules, of course, and chest X-ray bilateral hilar lymphadenopathy. So what is the diagnosis? Remembering that this case is acute. The answer is yes, of course, you answered correctly. This is Lofgren syndrome. For those who don't know what is Lofgren syndrome, wait for a minute. What is Lofgren syndrome? Lofgren syndrome is an acute variant of sarcoidosis. The usual sarcoidosis is subacute to chronic, with usually insidious onset, but the acute variant is called Lofgren syndrome. There is the classical clinical tetrad. Tetrad means 4 things. Tetrad of erythema nodosum, bilateral hilar lymphadenopathy, fever, and polyarthritis. It occurs most commonly in young white females. The diagnosis of Lofgren syndrome is based on clinical information with no need for further testing for the diagnosis of Lofgren syndrome. The only investigation is to diagnose or to detect bilateral hilar lymphadenopathy. And treatment, of course, is as usual for any case of sarcoidosis. And finally, thank you very much for your attendance, and we hope to see for the next case quiz. Wassalamu alaikum wa rahmatullahi wa barakatuh.